A woman says she could have been left with permanent eye damage because of a shortage of specialist services in Tasmania. Experts say patients are facing risks because access to specialist services is getting harder.
Life is slowly getting back to normal for Amy Pearce. 6 months ago, the northwest Tasmanian woman woke up with a crippling pain that turned her world upside down.
My eyesight started to deteriorate and I was really dizzy. I was bedridden. I couldn't leave my dark room. That's where I was stuck.
The university student was diagnosed with a rare brain condition that sometimes requires neurosurgery.
So that pressure on my brain was putting pressure on my optic nerves as well, and they were actually bleeding.
Getting to see a specialist proved difficult.
I was told that not to expect an appointment within 3 months because the system was clogged, and that we'd receive a letter in the mail with an appointment. That was it.
Amy's mother took her to see a neurologist in Melbourne. That afternoon, she was admitted to hospital, and 3 weeks later, Amy had surgery.
The neurologist in Melbourne told us that if Amy's condition hadn't have been treated when it did, and it had have been left, she would have had irreversible damage to her eyes.
Frontline health staff across Tasmania say that a lack of resources means patients such as Amy are slipping through the cracks. The waiting list is a concern. Theatre times and clinical times are limited. Staff levels are a concern. There are administrative problems. 60% of our work is emergency, and therefore elective is always being delayed. The Australian Medical Association says waiting lists for neurosurgery are unacceptable. The demand in the public sector exceeds the resources in that sector. The Royal Australian College of General Practitioners agrees.
I at times have to send patients interstate as well because the waiting times here for surgical procedures or for medical assessments are just too long.
The Tasmanian Health Service directly employs 2 full-time neurosurgeons. In a statement, the service said it had increased the number of procedures last financial year by 55%. Mrs. Pearce says that didn't help her daughter.
It failed my daughter, and I just hope that, we can do something about it.
Amy's focus is on resuming university next year. Henry Zwartz, ABC News.